Welcome to another episode of the Plastic Girl Club. I'm your host, Juliet. And before anything, I want to address why my face looks like a blowfish today from either angle. We're filming this on a Monday, but on Friday, I had my first ever injection of Kybella. Thank you to Miami Derm Pro, Paula at Asala Skincare. And so I kind of wanted to show you guys what my results look like post 3 days. 3 day post-op, I would say. And I didn't put any makeup, so you guys could also see my bruising. But besides that, let's get right into the topic of today, which is all things plastic surgery, one of my all-time favorite topics. And I'm joined by Miss Dr. Miguel Mascaro, top facial plastic surgeon, Delray Beach's hidden gem. And I'm so thankful for you to be a part of
Yeah, of
today
course.
and for
Absolutely.
joining
My
me.
pleasure. My
You're
pleasure.
super personable and so chill. I love your vibe. So thank you so much for
No, of
joining me
course.
on
No
your
problem. No
busy
problem.
schedule. I know you had a full day in the OR today, right? You must be
Always, man.
exhausted,
It's always a full day.
but
It's a good problem.
welcome.
Champagne problems. I tell
Yeah.
everybody champagne problems.
Those are all good things
Yeah.
to do. So share a little bit about yourself. Tell us how you got started, what led you to join plastics, and kind of your perfecting procedures, which is lip lifts and facelifts. Everyone wants to
Sure.
know.
So this is like the story that could go on forever. I mean, I was born and raised in Ecuador. I lived in Ecuador till I was about 13, 14. Then I moved to the
Nice.
States.
We're
Um,
neighbors then. I'm Colombian,
yeah, there you
so.
go. See? So when I came up to the States, at that point, went to college. My
Where'd
mom
you go
was
to
a doctor.
school?
I went to Cornell.
Nice.
And when I was at school, the brain always interested me. And so originally I wanted to be a professional athlete
Wow.
and I busted my
Is
knees.
that why you love the Heat?
And
We always love
yeah, I
the Heat
love,
lovers here. Do
love,
not
love,
rep
love
the Heat if you're
basketball.
not a
Yes.
fan.
No, I was so obnoxious and beat the Knicks. And
That's the only
and
sport I understand.
oh
And
God,
of course in the finals I get so into
I am
it.
so happy they're playing Boston because I can't stand Boston. I can't stand Boston. I can't
You
stand
heard it
it.
here, guys. We rep the
So,
Heat all day.
Boston tears are gonna taste so good, but, um,
We have like this
yeah,
hidden streak
yeah,
that
yeah, oh
we can't
god,
break. We're just a
I
little
cannot
luck of the
stand them,
Miami.
yeah, but, so, I always knew I wanted to do something with the brain.
Yeah.
Like, once I realized I was never gonna be a professional athlete and I
Just a
was
fad.
yeah, it just was in fact. So, I really like science. I
Nice.
thought about doctor, why not? Seemed good steady job,
Yeah, of
liked
course.
science, why not? And to me, I was always smart. So I was like, well, I want to be a neurosurgeon.
Yeah, you were
You
always
know,
curious
like I was
to,
like,
yeah.
I want to do neurosurgery. And so in college, I was a philosophy and neurobiology major. So I was a dual
Nice.
major, everything dealing with the brain. So philosophy, I was an epistemology major within philosophy. So that's the
That's
search for
super cool.
knowledge.
I love philosophy.
And
It's good.
then I kind of looked into it and I did the right thing, got into med school, get into med school, and I start going through, getting good grades because that's what you're supposed to do if you want to do neurosurgery. And I then go do research because that's what you're supposed to do if you're going to do neurosurgery. And I'm not kidding you, like 2 days into doing research in neurosurgery, I'm like, if I do this for a living, I'm going to shoot myself.
Yeah,
And it
it's not for
was
me. I need to find
not
a
for
different
me. I
outlet.
got to get out. And at that point, I'm already in med school. And I'm like, okay, well, what am I going to do?
Yeah.
Love sports. I like surgery. Let's look into orthopedics.
Yeah.
Not for me. Like it just wasn't my idea. And at that point, I just didn't understand what my idea of surgery was.
Of
And so
course.
that's what I had that internal turmoil of, well, I want to do
Defining
this,
that. Yeah, of
but I'm
course.
not sure what it is that I like within that. So I literally just started going through them like urology, don't like it. General surgery, don't like it. Cardiothoracic, cool, but I'm not
I'm
going to
not
do
into
this.
it. Yeah.
Vascular, whatever. And then eventually got to plastics. And the first surgery I scrubbed in on was a rhinoplasty. And
Ooh, those are
I
interesting. And you
thought,
have to be a good, yeah.
well, it's all about millimeters and shadows and lights and making sure that everything's perfect and how things are going to fit in that three-dimensional structure and thinking about how it's going to look 6 months from now, a year from now. I loved it. I thought it was the coolest thing ever.
It is. It's very,
And
very cool.
so I got interested in plastics, and to me, facial was the most interesting. And part of it is, I mean, honestly, it's a little bit, from my standpoint, it's just a little kind of greedy
Yeah.
in that there's really no safety net,
Mm-mm.
so
And I would
you
say it's
can't
the most
throw
difficult.
well, you
Yeah.
can't throw a sweater over it,
Yeah. You're
so
stuck with that.
you have to be super precise about it. And to me, like the competitive aspect of it,
Yeah.
to me, that was really appealing.
'Cause it's
And
kind of like sports. So
it's
you wanted
very
to continue
so
to, yeah,
get better and be the best and do this better than anybody else.
yeah.
And
And you do.
so
I
I
do think
really
you have
look
extraordinary
well,
work.
and so we were talking about how you get into lips,
Yeah.
and so eventually get into plastics, and I end up liking cosmetics, and that's a whole nother story where I kind of dug that,
Yeah.
and then I really liked a certain segment of it. And to me, when I first started, it's tricky because I was always advanced. And so when I finished, I was like a
What
32-year-old
else?
kid
Yeah.
who, I mean, I'm not 32 anymore, but I look
You
young.
look
I look
32.
young. And so I looked much younger then.
Yeah.
And so it's hard to get people to trust you and
Yeah.
to kind of listen to you. And so for me, it was kind of frustrating because I kept thinking, I'm like, well, much smarter
Yeah.
than, the
Your
guy with
average
the white
person.
hair.
Yeah, exactly.
Also
And
much better than
and
the
you
guy with
bring
the
a
white
different
hair.
take. I would say a
And it's totally
fresh,
different. Well,
yeah.
it's a different aesthetic and different
Yeah.
techniques and all this stuff. And so to me, it was always about proving like
Your
how
skill
much
set.
better I am at this than somebody else.
Yeah.
And what was interesting about lip lifts was that I found myself in a very interesting segment, which is where I practice in Palm Beach. There's a lot of older patients
There is.
who are ideal candidates for lip lifts, and nobody was doing them. And it's because historically,
Yeah.
techniques that were used just weren't good.
They were horrible. They would
And
leave you with like some horrible
scars.
scarring.
They were, bunching up the muscles. They weren't really releasing the tissue appropriately. So it wasn't natural. The lips were moving funky. Everything looked terrible. So people didn't do it. Totally
It was a
understandable.
frightening, yeah, it's a
Totally
frightening concept
understandable.
to wrap your head
But
around.
it's such an important part of rejuvenating the face because when you're looking at the face, the first thing you look is the eyes, then the
Nose
lips.
and the lips, yeah.
Right. So if you are doing a facelift, brow lift, eyelids, but the mouth is still long, your brain is going to think that something's off, like they're not fully
Yeah,
rejuvenated.
nothing is balanced in your face at
So
that
to
point.
me, it was a complete no-brainer. And I started doing a little lip lift here, a little lip lift there.
Do you
and
include the
quickly,
lip lift in your facelift
not in all of
procedures?
them. So they have to be good candidates, right? So
Okay.
like anything else, you got to be a good candidate for
Yeah.
it. And started doing one, then two, then three, then four, and eventually people kind of started seeing the results of the
And they're
technique. And
outstanding.
so to me, it was like, well, how can I stand out from this,
Yeah.
right? How do I show what I can do with this? And the thing that differentiated me from everybody else was 6 or 7 years ago, I started showing up close of the incision work.
Yeah,
Because
that's
that's
what
the
I
thing.
love.
Because that's the thing that people care about,
Yeah.
particularly when you talk about their face.
I think that's one of the
And
first things somebody asks when they're doing some type of
absolutely
intricate
is
face surgeries. What is my scar?
it's what's my scar gonna look like. And there oftentimes you see work 6 or 7 months or 10 months or a year and a
Maybe a
half down the
year.
line. Once scars matured, things look better from far away with makeup on. And I pivoted. I said, you know what? I'm gonna do the exact opposite. I'm gonna show you that on day one, you can look better than anybody else of these other guys. You can show me the most expensive dude out in anywhere else in the world.
I
My
love that.
stuff will be better on day one.
Yeah.
Period.
Do you think it has a lot to do with your technique or the products that you use?
So
the
here's
sutures,
the dirty
time you take doing these
So
procedures.
here's the dirty little
Right?
secret. Nothing I do is anything that nobody knows how to do, right?
Yeah.
And so
It's
the
like your own
biggest
recipe too.
exactly
Can't share it.
it's like
We're not sharing it.
well, it's like making chocolate chip cookies, right? So there's 1,000 ways of making chocolate chip cookies, and I could give you my chocolate chip cookie recipe.
Yeah.
But if you make my chocolate chip cookies, they're not going to taste the same.
No, yours are the
And the-
only cookies.
And
that
that's what
will
it
be
and that's
those.
what it comes down to because nothing that I do is a secret.
Yeah.
It's the same techniques that you teach when you're a surgical intern.
Yeah.
But it's a matter of feel and it's a
Perfecting the
it's a little
craft.
jazzy, right? Where you
Yeah.
have to feel the tissue and make sure things are going well and doing things right. And the biggest mistake that people do is they confuse things for easy,
Yeah.
right? And so just because it's simple doesn't mean that it's easy.
Yeah, of course.
So nothing I do is complicated. Everything I do is very simple.
I do
but
want to
it's
say
not
that it
easy.
is, and from my experience, I have heard that from consumers as well, that it's such a like a quick procedure, get it done in an hour. You could even, I've like crazy stuff that you hear here in Miami. It's like you could do it under local anesthesia. Like I feel like the most important thing is to secure your end result, and the best way to do that is by picking board certified facial plastic surgeons or a surgeon that is a master in his craft and that's perfected
That's
a procedure
experienced,
like this. Yeah.
absolutely. 100%. Like,
I
and
agree.
people do this with other procedures, right? People do this where they're
Combination.
right when they're well. What I'm talking about is, for example, they'll say, "I have a complicated rhinoplasty." Like I don't have that regular rhinoplasty. I'm gonna go to a guy that specializes in complicated rhinoplasty.
Yep.
Perfect. Do that. That makes perfect sense.
Yeah.
I have Asian eyelids. I need to go to a guy that just specializes in Asian eyelids.
Yeah.
Perfect. That makes perfect sense.
That's
So
true.
wouldn't you carry that same idea with everything else
Of
in the
course.
face?
Of course.
And I just had a patient of mine, and the Asian eyelid thing reminds me because I saw her today, did her lip lift, doing her facelift on her, and she told me, "Hey, my friend's coming in, Asian eyelid. When's the last time you did one?" I told her, honestly, 8 years ago. You should not come see me. And she's like, "No, but I wanted to see you because the incisions are perfect." I'm like, listen, if she wants to look like a white lady, I can do that.
I love
But
your honesty though.
but
You
it's
have to
not
be
gonna
honest
work.
with patients, and you don't
100%,
see
no.
that in the beauty game or in the plastic surgery world. I do
No,
think that
there's
that's
a
a
little
little.
well, there's a little bit of that car salesman thing,
Yes,
and
why? It's
it
not good for us.
no, it's so cringy. It's just bad. I don't understand it because nobody wins,
Yeah,
right? Nobody wins. And
exactly.
so to me, if I send somebody out, my biggest referrals are every patient that I say no to.
Yeah.
Every single patient that I say no to.
Because they appreciate the honesty, and it
Right.
doesn't seem like you're just trying to get a treatment done. You're just like, truthfully, in my experience, I do think that I will have an outstanding result, or hey, I think you should go somewhere
Well,
else.
particularly with what we were talking about beforehand, and I mean, I guess people are going to know about this, but we were chatting for like 30 minutes
We really
beforehand,
were.
and we turned around, we're like, "Are you recording any of this?" And they were like,
They didn't even
"No,"
catch the
but they
good
didn't
stuff.
catch any of the good stuff. But just to kind of summarize some of what we were talking about is it's super, super, super important to kind of be in tune with what it is that you're saying. And when we're talking about aesthetics, particularly with like New
Cosmetic.
York, LA,
Yeah, oh, yeah.
Miami, where we were chatting about a lot about that.
Yeah.
I have so many young patients from LA and
Yeah.
so many young patients from Miami that
Yeah.
come in. And this is standard consult literally happened 3 hours ago where I'm talking to her and pretty young girl, late 30s. Does she need anything?
What does she want?
No,
Yeah.
of course not.
Yeah.
But she's starting to see a little bit of jowling. She used to model. She wants to get back in the game. She's seeing that her
There's trending
job,
treatments
well,
too. The jawline contouring, all of
100%.
that is
Her issue
definitely
is
in.
that she's seeing the jobs that she was getting, she's no longer getting.
Wow.
So in her case, it's more than just vanity. For her, it's
Survival.
I need to put food on the plate.
Yeah.
And I still look great. I still get these jobs, but I'm seeing it miss out. And so then my question is, well, how far are you willing to go down the rabbit hole?
Yeah.
And so my very simple question to her was, you're young enough where we can go about and do two different things
Yeah.
when we're defining the jawline. And this goes a little bit to what we were
Yeah,
talking
of
about
course. I
earlier,
think they want to hear it.
that
They're dying to know about what we can
was
do.
we could do minimally invasive
Okay.
with some radio frequency, do a little bit of liposuction, do some contouring, think of me as your fancy makeup artist. I'm just playing with lights and shadows.
Nice.
Or conversely, we can do surgery. And I can't tell you what's going to make you happy. I'm just going to tell you what each one entails,
Yeah.
what the risk benefits of them are. I know the result you want can only be achieved with this one.
Yeah.
But
Do you give them the option to decide?
100%.
Wow.
And I'll tell them flat out, I'm like, I know that what you want in your mind is this, but let me explain to you what that entails.
Yeah.
Because it's not you pop in, pop out, go home.
Yeah, they
and
miss
2 weeks later,
people
you're
miss
hanging out. It's
they
not like that
erase
at
the whole
all.
pre and post operative
Of
experience.
course.
They
And
erase
it's
it.
totally different. And the post-op feeling of what did I do?
Even
I
the
don't
emotional
recognize
toll
myself.
on it. You
It's
have
the
to have some
worst.
support.
It's the
A lot of
worst.
people
The
don't
devil
speak
that
on
sits
that.
between your ears is the worst enemy.
Yeah.
Always, 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 always. And it does take about 3 to 4 months before you start saying, that was amazing. It was the easiest thing I've ever done.
Yeah.
Let's do it again. And then
Yeah.
I have to remind you, remember when you had that freak out 3 weeks afterwards? You thought you were never getting any
It's
jobs
kind of like
now?
me on my third day. I'm a blowfish. I don't see anything. And again, that leads me to the other question, which is how do you know if the patient is a good candidate for the specific treatment that you're offering them?
I think the key there,
Yeah.
more than anything, is expectations.
Yeah.
And so to me, I always like to think of it as if you were my sister, if you were my cousin, how
Would you
would
wanna
I
go?
push you in what direction?
Yeah.
And so you need to tell me what it is that you're expecting. So, for example, pretty girl, late 30s, early 40s, comes in and says, Miguel, I keep doing this in the mirror. And I'm just like, okay, well, the only way to do this is to physically do this.
Yeah.
If I do microneedling with radio frequency or more aggressive radio
Morpheus
frequency,
8 or any type
Morpheus
of
8, Pixel, Infini,
RF, yeah,
whatever,
yeah.
or I do Thermi, FaceTite, whatever,
Yeah.
profound. that doesn't lift, that shrink wraps.
Wow.
And so when you think of it that way, I think it's really easy for patients to visualize and like, oh, I'm not lifting, I'm shrinking.
You're just tightening it. Yeah.
So I'm gonna get 3 to 10% improvement in tightening. Yes, it's gonna look better,
But
but
it's not
is
gonna
it
get you
giving
to
me
where
that
you're.
look that I want? And so there's some patients that'll sit there and say, you know what? I'm okay with that shrink wrapping if it means that my downtime is 4 or 5 days and
Yeah.
it takes 6 months. I'm cool with that. And then in a couple months, I'll do this. And then there's other patients that'll tell you, absolutely not.
Let's do what we need to do.
I'm jumping into the deep end of the pool.
Would you say that it's beneficiary to do these types of treatment prior to having a facelift invasive surgical procedure?
Depends.
Or do you think that
Depends
some
on
people
how
should just steer?
aggressive.
Yeah, or if people have had any type of skin concerns or skincare routines prior to a facelift, right? Because I'm sure you're going to get a patient that's 60 years old or so and has never done anything
Yeah.
to their face.
Right. And at that point, you're like, well, we're
You
doing
have no other option but
right.
surgery.
You have to do all this, but you also have to maintain it and upkeep it.
Yeah.
And so to me, I've always been more of a put out the smoke before it becomes a fire
Yeah.
kind of
Just trying to
idea.
take it out. Yeah.
You know, just listen, I want to look good now and fix it. As far as these other minimally invasive procedures, I think they have their time and place.
Yeah.
I think like anything else, I think that they're getting a little overhyped.
They are.
And so this is what we were talking about, the used car salesman,
Yeah,
where people are kind of promising these minimally invasive facelifts. And then you
Or
see
using it to compare it to a facelift
and
or
then you
an
see
eyelid
and you see all these patients then afterwards are super upset about it.
because they were pretty much trickled into.
Well, they
I
were
wouldn't say tricked, but trickled into.
well, they
that.
were expecting a facelift, right? And what I always tell patients is those are great procedures for what they do.
Yeah.
So if you take a look and you see the before and afters on them, they're always up close pictures of fine lines and wrinkles.
Yeah.
And they let the consumer make the assumption that
That is so
if
true.
we're seeing these changes in these small areas, if I do my whole face,
Yeah.
then I'm going to see that magnified
Absolutely.
tenfold, 100-fold, whatever it may be. But that's not what happens. You know, you're seeing microscopic changes. So for fine lines, wrinkles, stuff like that, it's awesome. Scarring, awesome. Acne scarring, perfect.
Yeah.
But are you going to get a facelift from it? No. Now, what can happen is sometimes patients get misguided. And this is, again, where the issue with the used car salesman,
Yep,
you
yep.
know, kind of bad mentality.
The pitching.
Yeah, and you end up going to a med spa or you go to a dermatologist or you go to a plastic surgeon
Yeah.
because we're just as guilty as everybody else.
They're bringing it into their teams as well. It's a
Absolutely.
part
So
of
we
their
have listen,
stuff,
I
yeah.
have Pixel in my office, but
Yeah.
we're super selective about who it is.
Yeah. Or even using it in the right technique. So using it
100%.
after a
Yeah,
facelift or
right. Yeah,
right?
exactly.
That's what I was
Well, you tighten up and then you shrink wrap.
Yeah.
Right. So then that makes more
that makes more of a better combination.
it just makes more sense,
Yeah.
right? Intuitively. So
That's why I asked. I was like
yeah.
I was always very curious to that, which is like, do you prepare for a facelift or do you try to, advance your results from that
Because
facelift?
you can
or
burn
you continue?
bridges. You
Yeah.
can burn bridges if you're doing this shrink wrapping.
I was just gonna say then you
beforehand
wouldn't have
because you're
enough
causing scar
skin.
tissue. So you're not getting the right lift.
Yeah.
And so it's not uncommon, I'll do facelifts on like these lateral mini lifts on 35, 36, 37-year-old super pretty girls from Miami. And as I'm lifting, I'm just like, this is tight. Like this is really scarred down.
And they all
then-
usually have
And
those.
they
treatments.
all lie about it, right? They all tell me like, "Oh no, I didn't do anything." And then afterwards, I'll tell them like, "Did you have something here?" Like, "Oh yeah, I went to Colombia and did some Vaser, 6 or 8 months ago." And I'm just like, Jesus,
Cool skull
like,
thing, right? I
yeah.
heard
I'm
some
like,
horrible
I'm like,
things
you
from
could have
that.
just told me.
Yeah.
And then, I mean, not that it would have changed anything, but at least mentally,
I
I'm
think you have
prepared.
to be you have to be honest with your surgeon. You should definitely
It
own
just
up to
makes life
everything you've had
easier.
done.
I'm not
Yeah.
sitting there struggling, being like, "What is
Yeah, they're trying to
wrong? Like, what
tug.
is there? Like, this doesn't make any sense."
Yeah.
And then you're seeing like scar marks along the way on the tissue. And like,
And
come
then
on,
I had
guys.
asked you also if you are commonly doing facelifts with combination neck lift. And that's what I would think would make them more sense.
Yeah.
Is then you would have the sagging neck with the lifted face.
Well, so historically,
what do you
it's not as
suggest?
crazy of a question
Okay,
as
cool.
as I made it out to be when you asked it to me earlier, and I was like, of course, I'm doing the neck at the same time.
But I'm sure people
because-
ask for just one or the other, right? Or
Right?
even
Because
for like
well, historically, you would just do a facelift,
okay.
and then you may do a neck lift.
Hmm.
And the reason why was because the techniques were very different.
Okay.
And so they relied mostly on skin lifting. And what we're doing now is mostly muscle repositioning.
Okay.
So when you're doing a facelift, by definition, as you're repositioning, you're gonna reposition some of that neck muscle as well. So when we talk about facelifts, neck lift is included. The reverse is not necessarily true.
And if I were to do, or if I were to be an early age patient that just wanted to take care of the neck and say, hey, I want to do a neck lift, and you agree, okay, you are a good candidate for that. Is there any post surgery concerns later on when I am
Not at all.
80 or 60 and
Not
my
at all,
face is
because you'd be
sagging
doing
now?
the exact same thing.
Okay.
So
Just
it's
taking
totally
a little
fine.
longer to do that
Yeah,
treatment.
the
Okay.
the one thing is that you have to be aware of what the limitations are of a neck lift alone. And this is what I tell patients all the time, because more often than not, they'll tell me, I have jowls, I want to fix my neck.
Yeah.
And what I tell them is when you're doing a neck lift alone, if you were to put your finger and draw it right on the mandible on your jawline, anything that's sitting on there is not getting fixed. It's only below
Yeah.
because
Anything
you're
from
not
down
lifting.
here
Yeah,
under.
you're
Yeah.
not lifting. And so
Yeah.
to fix the jawline, unfortunately, you do need to do either a lower facelift or a cheek and neck lift. And so that's what's going to
Let's get
pick that
into
up.
that. The cheek and the neck lift. I mean, the cheek and facelift suture would be under. I mean, behind the ear.
And
Can
then
you
it
educate
goes,
me or school me on
sure,
that a
no
little
problem.
bit?
So very
Where would
easy.
I
So
expect
super,
that?
super, super easy. So you put your thumb at the angle of your mandible, index finger, corner of the eye, walk it down to the cheekbone area. You get those 2 points going up and back, right? So as you go up and
I
back,
definitely need a
you're like,
facelift.
I need it. Everybody
I
needs
need it.
it.
I'm 30. I need
So,
this.
so as you pick that up, what you're seeing is you're seeing some pleats
I do.
right here.
Okay.
And so what that means is if you're making the bed, you got to redrape that.
Oh yeah.
So
Look
you
at the
just
skin I
so
have,
you just
Lassie.
pick that up, and that's where your incision starts. Starts at the top of the sideburn.
Does it hide
Then
with the hair? Yeah.
you hide it in the hair.
Okay.
Because if you keep it inside the hair here, what you're doing is you're taking this whole sideburn, lifting it upwards. So then you end up with no sideburn. That's really bad. It's not a
And
good
you could
look.
tell right
And you
away
can
that
tell right
somebody
away.
had a facelift.
And that's a
I'm always
very
like trying to look at you had a
and that's a very
facelift.
so that's a very old technique. That's a technique that was done in the 70s and 80s where you would actually hide it in here. It's
It's
dumb.
not
So
successful.
just take your time when you do it through here. It heals super nicely. So you
Okay.
carry that up, and then you go inside the ear,
Oh wow.
and then right around the earlobe, all the way in the crease in the back. Keep it super high, and then it goes into the hair. So you can wear your hair back in a ponytail. You can have your hair just flowing in the breeze. Nobody's ever going to be able to tell. And so then that way, you're not only tightening up here, but you're also
Lifting the
tightening up
neck
right
as
there.
well. Wow, that is honestly, I think, like the holy grail for anyone that is looking to. I don't know why everyone is so obsessed with lifting their skin, even now. I feel like it used to be such like a your mom, your mother-in-law, your
Well,
grandma,
so what's
and now it's
interesting
like
is,
me at 30. I'm like, I need a face and neck
well,
lift.
I think that what we're seeing is two things.
Yeah.
One is historically it was very taboo. About 15, actually more than that at this point, about 20 years ago, there was an article that came out where they did some research as to when women were starting to think about this kind of surgery. And it turned out it was between 52 and 54, which coincides when menopause starts to happen.
Yeah.
So hormones change, skin changes, elasticity starts to go to hell.
And
right?
I don't think back then
And
they
so-
had that many
Right.
things
And
that
so-
they could do
But
to.
what's interesting
Yeah.
is that you're looking at these patients and you actually would think like, wow, I would think that it's older. But the question was when they started to think about it. And like you just mentioned,
I'm thinking about it
they didn't-
already. It's in my mind.
but like you,
I mean, is
like
it
you
because
just mentioned,
you're right here with me? And
Probably.
I looked you up.
probably, but like you mentioned,
Yeah.
part of it is there wasn't anything else that you could do. It was, you either do this or nothing.
Yeah. And most
And-
of the people doing it had never done anything
Correct.
prior to.
And the techniques were kind of based on the idea of reconstruction.
Yeah.
And so the way that I think of things and how we'll tie all this together is when you think of rhinoplasty historically was you broke your nose, you can't breathe.
Yeah.
That's it, right? So as they were doing those, eventually they said, well, if you're a 16-year-old girl and you got a little hump in your
Or
nose or this, like, why can't we just fix that? It's the same techniques that we're doing. We just modify them a little bit.
Yeah.
And eventually, rhinoplasty went from being a reconstructive functional procedure to a cosmetic procedure. And I think the same thing's going on with aging
Yeah.
face. I think historically, aging face, we don't like to say this, but it was a reconstructive procedure. It was things are falling down. I'm going to pick them up and put them back to where they used to be.
Yeah.
But once you're in your 60s and 70s, guess what? You've had bone loss, you've had volume loss, your skin's changed.
No
So
collagen
it's-
production.
So
you're
it's
just
no longer a beautifying procedure. Yes, you look better. You just look like a lady who had a facelift. So you look better, but it's not that much better.
But I do think there's
as
a
you
lot of
get
reward
older.
that comes from that.
100%.
When you fix something like that
No,
and it's like
100%.
now everyone notices.
No, it makes a big
you're
difference in
20 years younger.
confidence. No, it makes a big difference in the confidence. However, there's a big difference when you're doing that on someone who's in their late 40s or mid 40s. When you're doing that in someone in their mid 40s or late 40s with the techniques that we have now, where we're repositioning muscle as opposed to really pulling on skin super, super tight, guess what? Now it becomes a beautifying procedure again. So all of a sudden, we're really picking them up on that conveyor belt of time and setting them down. It's
Yeah.
a true time machine procedure. And
Absolutely.
so I'll have these patients that are in their early 40s, mid 40s, and they come out and they look like they're 25, 26,
No, no,
27.
your before and afters. I
It's
even think I
insane.
posted one today on the IG page.
Yeah.
It's like it's crazy to me
Yeah,
because this
I'll show you
before and
one. I'll
after
show you one actually that I
is
have that she sent
insane.
me. It's ridiculous. She's 42. She looks like she's 21.
Y-
And it's one of those things where when you're doing it younger, you really see the huge benefit in it.
Would you
But
advise to start early?
here's the
Kind of like
caveat.
baby talks. Would you
But
say, should we start doing the lifting?
here's the caveat. You need to have the laxity and elasticity.
But we're
So
killing it with all the other stuff we're using, right?
and that's what we're seeing,
Okay.
right? So I have a couple of patients of mine that are in their early 30s that did way too much partying, way too much drinking,
Drinking. Ugh.
treated their skin like, crap for the
Went
last
to
10
sleep with
plus
their
years.
makeup. Don't do
Yeah,
it.
don't do that. But they did a lot of other things. And, they got caught up in the party lifestyle. They're in their early 30s. Again, models in LA, they're coming in. And it's not uncommon for me to have one of these younger patients that have more laxity and elasticity than someone who took care of their skin,
Yeah.
who's in their late 40s, early 50s.
Yep.
And so that does not mean you need to do something in your mid 30s. That just means if you take care of yourself,
You might.
you probably won't need to do something until later on. So
Yeah.
it's more of an advertisement for just take care of yourself.
Yeah.
And then
of
you'll be in
course.
good shape.
Of course, which leads us to the next topic, which I wanted to emphasize, which is your scarring. Do you have a specific recommendation for your patients? Are they
Yes.
using like
I'm
the
super
holy
anal.
grail skincare
No, I wish
for
it
the
was.
scar?
I would make so
What
much
do you
money. I
do?
wouldn't even
They're
be.
just perfect.
We'd be doing an interview with me and Sandro Pay right now if I had some product that I could just
We'd
sell.
be in Lake Como.
Yeah, we would not be here.
Or we'd be
Yeah,
in
we would be,
the
we
Miami
would,
Heat
yeah,
game.
we would be chilling somewhere else. But no, so I'm super anal about it. So
Yeah.
I tell everybody this: it's a three-way race, right? So it's a relay. So 80% I do.
Yeah.
So my job is to make sure that it's pencil thin, looks perfect. And this
Nice
is what I tell
and-
everybody: is even with the stitches in place, it's going to look incredible, better than anywhere else.
Yeah.
Number one, I'll do my job. You don't worry about that.
Yeah.
Number two, you got to take care of it.
Yeah.
And so you need to make sure that you follow instructions.
Scar
you're
cream,
doing the right things.
SPF, don't sit in the sun.
Everything. And I'm super, super, super specific about how things are. I'm really easy to get a hold of. I tell my patients this all the time. There's no excuse. I'd rather you message me, text me, email me, snap me, tweet me, TikTok, whatever.
Interest you.
Like
Pin
I'm
me.
super easy to get a hold of.
Yeah.
And ask me a stupid question.
I love that actually. When I reached out to you, you were super quick with it. You were like, I'm down. Let's do it.
Yeah. No, like it's I'd rather you ask me
Yeah.
and me tell you that's dumb.
Yeah.
Then you do something, wait a couple months, and then message me and say, hey Miguel, I've been doing X, Y, or Z.
To ruin your result.
This is what this scar looks like. Do you think I should do this again? And I'm like, you shouldn't have been doing any of that.
Yeah.
So I'm super easy to
Do
access.
you also qualify patients, like if they are heavy smokers or if they?
I'm not that picky about that. Like
Do you
some
think that plays a
people-
big role though with their
Yeah,
scarring?
for sure.
100%,
Of course.
right? Yeah.
Absolutely. I just tell people, listen, I'm honest with you. You be honest with me. Like, I just don't want you to tell me like, hey, you're
Post
coming in-
surgery the next day.
Yeah,
you're-
like I mean, no, like I've had patients that like I keep all my patients overnight in my office
love
because we
that.
have overnight suites for like facelifts and stuff. Big
That's good to
surgeries.
know because there's a lot of patients that
They just get kicked to the curb.
exactly.
But
exactly.
yeah,
Good
that
to
way you
know.
have your own nurse, etc. But there's many patients that'll come in and like my nurse will catch them vaping in the middle of the night, and I'm just like,
That's why I asked that question because I feel like that's probably one of like the
Yeah,
most
and I'm
difficult
just like,
struggles
right,
with
and I'm
this,
like,
right?
guys, like, listen, is it cool if you vape? I don't care.
It's
You
gonna
know,
affect. You shouldn't be
it's-
vaping if
but-
you're having
but-
plastic surgery.
But like, you just had a facelift 4 hours ago.
Yeah.
Man,
Yeah.
come on, bro. Like,
Yeah.
don't do that. And so, it's as long as you're honest with me, I'm fine.
and
with
you're
it
gonna
because
guide them through
I'll
what
guide
they
you
should
through it.
do.
Yeah, because
and-
then that'll
and
change.
avoid.
Because then that'll change the treatment regimen, right? So we'll use a little nitro paste. We'll do some hyperbaric oxygen dives. Like we'll switch it up just to kind of nourish that skin. So I'll work with you. But it's funny because they'll come in, and especially even a consult, if someone's super open, they're like, listen, I just want to be open
yeah,
with
of
you.
course.
How do you feel about smoking? And I'm just like, well, the doctor answer is you should never smoke.
You shouldn't ask this. to
So
the
why
doctor.
are you asking me?
Yeah,
Like, I'm
yeah.
going to tell you, don't ever smoke.
Yeah,
But
of
if
course.
you're going to, if you could quit like a week before, that'd be nice.
I would think that
Hold
somebody
off.
trying to get these treatments would at least post surgery be like, okay, I'm gonna go get some nice
You
skincare.
think that? No,
I'm
people
gonna
sabotage
go.
themselves all the time.
So this is why we need to tell them they should not. They should definitely not.
Yeah, people are their worst enemies
So
all the
before we
time.
end today, I actually want to tap into another, like, I guess, trending surgery or procedure that's occurring, which is hair restoration. For a long time, people have been speaking about PRP. I do think it's kind of dying down now with the exosomes and all the other like talk on the benefits and disadvantages of it. But could you tell us about what you offer with hair restoration, which is
A little bit of
huge
everything.
post COVID and everything?
So from hair transplants
Yeah.
through PRP and just kind of autologous injections. The downside of PRP is that it's dependent on your own tissue and your own body. So what does that mean? That means if you eat like crap, smoke all the time,
Don't exercise.
have a crappy lifestyle,
Yeah.
your blood is going to be a reflection of
Of
that.
that.
So it doesn't matter how much I concentrate those platelets. And I like to do super PRP, which is basically
us.
so traditional PRP is a 5 to 6 time concentration. That's really when you're seeing the improvement in hair restoration, new blood vessel,
Skincare,
all that
collagen
stuff. You
production,
got to
okay.
be at least 5 to 6%, 5 to 6 times
Okay.
your baseline platelet concentration. There's not a lot of systems that achieve that. So some of them will try to augment with a cell, all sorts of other things. And that's where like kind of exosomes come into
Yeah.
play. The ones that I like to keep mine concentrated to around 10x.
Okay.
So it's super concentrated.
Love that.
So, which is great. It burns like hell because it's super concentrated.
But I like the extra concentration.
But it's good. It works. And I love the result.
potent.
Yeah, it's potent. It's a little stronger. Get a little extra sauce in there. But it works well.
Nice.
Now, the downside is that it's somewhat unpredictable because it's dependent on your own tissue. So,
For a more successful
right, you want something
result.
that's a little bit more standardized. And there was actually this product that was amazing that was out, but they took it. Basically, the company was bought out by the Defense Department, and now like
Wow.
yeah,
They don't
now
want us to have our
they
hands
basically
on it.
don't.
Yeah.
No, it was only out for like a year,
Wow.
and they actually started using it in combat, and it was like regenerating tissue incredibly. Got an
They had to
immen-
take it down. That's it.
so,
it's
no,
it's
no,
working too
literally,
good.
that's what happened.
No,
So
and
they got bought
totally
out.
believe
They
that.
got bought out by the Defense Department. And I was trying to get some more, and they're like, "We don't make it." And I was like, "What do you mean you don't make it? It's the best product ever." And they're like, "Yeah,
So if
we got a
PRP
huge
doesn't-
contract by the Defense Department. Now we're just
So we're
just
screwed if
going
there's
to
no
that."
PRP or
Yeah,
well
it's a
then
bust.
now restoration, right? Like doing which I
Transplants.
heard is a very
Transplants are great. Now,
okay.
the downside of transplants is they do take time. So the dirty little secret about transplants is it's very rare that it's a one and done.
Yeah.
And that's the issue with hair. Hair is the best way to think of it. Think of it like blood pressure.
Yeah.
Once you take a blood pressure pill,
Luscious hair.
dude, you're good.
But I'm saying those like, or even my fiance, he's like getting those little bald
Oh,
spots,
the
and we're
little-
like the
the little
PRP. I'm
entradas?
like, no, we need the
Yeah.
hair restoration.
Listen, the
there.
problem with PRP is once you don't have any crop there,
Yeah.
it's not going to magically grow. So if you think of PRP, think of it like Miracle Grow. So if you go to Home Depot, you get some Miracle Grow, you start sprinkling it on
Sprinkling
the
it everywhere.
sidewalk. Guess what? Trees aren't going to magically grow on the sidewalk.
It takes time.
It's not going to happen,
Yeah.
right? But if you have a little bit of a thinning garden and you're putting the Miracle Grow, it's going to grow.
Yeah.
So you're dependent on the follicular status. So if you've got follicles, it's going to grow. If not, it's not. And that's where hair restoration comes into play. Hair restoration is you're physically putting trees in the plot of land
And successful trees that are bound to
that
grow.
are bound to grow,
Yeah.
which is nice. Now, the downside is, like I said, it's not usually one and done because if you've got a genetic predispositioning to losing your hair, unless you're playing some defense, all the offense in the world is not going to work.
Gonna help
You're
all the
going to
way.
be chasing that dragon for the rest of your life.
Yeah.
So you need to be super good. So if I have young patients, I always put them on either some sort of dihydrotestosterone blocker, right?
Okay.
So either if they can Propecia, a lot of guys don't want to like take Propecia because of the side
Of course,
effects
of course.
or the side effect profile. But I love Nutrafol. I take Nutrafol,
Oh,
and
Nutrafol,
so
I've heard wonderful things
Nutrafol
about
works
it.
amazing.
Yeah.
I don't get paid by Nutrafol.
This
Trust
is
me.
not sponsored
I
by
wish-
Nutrafol.
I wish I was.
Hi Nutrafol,
Yeah,
we are here.
sponsor me,
We're
please.
here.
I will gladly take a check from you. But no, it's actually a really great product.
Okay.
And it works fantastic. So I'll put my patients on it for 6 months beforehand.
And
And
prepare them before the
because
surgery.
I want them to be consistent with it.
Yeah.
If they're not consistent with playing defense, then they're not ready to do a surgical procedure because you will have to keep that going
Consistency for
afterwards
anything in
anyway.
life, I would say.
So yeah,
You
so
just have
if
to
you're
be
not doing
consistent.
it beforehand and you can't do it after, then guess what? It's not going to be worth it in the long run because you're going to do the transplant. It takes about a year to year and a half to see the full result of the transplant. Then you're going to be thinning elsewhere. You're going to come back and you're going to be like, oh, now I got to go do this. And I'm like, yeah, because the hair that you're losing now is the hair that was there before, but you never played any
And
defense on.
it could be part of like your genetics, but I do think that
100%.
like post COVID, I mean, everyone was just kind
Well,
of
there was
more
there was the COVID hair loss too. There was a
enhancing,
lot of people that lost hair with COVID.
and that they
So
were more like, I guess that raised awareness to the hair loss. I feel like before the hair loss was kind of like hidden and you would kind of hide it over your hat or whatever. But now I feel like they are definitely paying attention to that. And it is part of the beauty routines that people are incorporating,
yeah,
making sure that they have a good
and not
line of
only
hair.
that, and yeah, and not only that, but I mean, like we talked about, social media has made everything so readily
Much,
available,
yeah, yeah.
so readily available. And, I mean, if you just search it once, the algorithm knows it's going to start showing it to you
It's gonna
over and
start
over
showing
again.
you where you can get
Oh,
it,
yeah,
who you
not
can
yet.
get it, and at
Everywhere it's
what
going to show you,
price.
yep, everywhere. And so it makes it very readily accessible to people. And I think part of the stigma behind a lot of these procedures is people think about it, but then they're like, I'm the only one. I'm being crazy. I don't want to do this. I don't want to be judged by my friends, family, coworkers, whatever.
Yeah,
And now that you're seeing more and more people do it, you realize the
I'm
biggest
into it.
thing.
Let's do it. Yeah,
Yeah. Well, the biggest thing that most people realize. And once you get to that point where you say, nobody cares.
yeah. You
Nobody
just have to care
cares.
about yourself. You have to
Exactly.
love yourself the way you
It
are.
doesn't matter what anybody else
Fix a
thinks.
couple things you
Yeah.
want to fix because there's nothing
It
wrong with
matters. It
that.
matters
But
to me. I'm gonna do it.
yeah,
And I don't care.
yeah,
And that's what you're seeing with social media.
yeah.
So for all the bad that social media has
Has.
caused, because yes, it does standardize a little bit everybody's body dysmorphia. We're all
Yeah,
little body
yeah, we
dysmorphic,
all do.
but
I'm owning it.
it's funny. I joke with people. It's not an on-off switch. It's like a dimmer.
Yeah.
You just don't want to be fully dimmed up. And so it's okay to be, a little anal about certain things, but it's made it very, very prominent, accessible, and
Yeah.
people all of
You
a
just
sudden
have to
think like
stay
this.
true to yourself, but also
100%.
educate yourself and also have realistic expectations, which I think was like one of the main things you said as
Yeah.
well. Just making sure
100%.
you understand that. And then that way you can enjoy yourself post treatment, post surgery, and then making sure you follow the right order of things, no smoking, no vaping 4 hours later,
Yeah, please,
not
God, no.
tanning at the SLS, okay?
Yeah, no.
So,
I
because
listen. I have
it could get
patients. I
overwhelming.
have patients that'll do laser,
Yeah.
and then literally the next day they'll send me a selfie from the Four Seasons pool, and I'm
No,
just like, "What are you
no.
doing? Like, what are you
We
doing?"
have to be a little bit more careful with that,
No,
but we absolutely loved having you here, Dr. Mascaro. It is a pleasure. I do know
of
you're super
course.
booked out for the next year, I would say.
Yeah,
So
year
if
and a half.
somebody
Yeah.
is looking for a special spot in your schedule, where can they find you? What is the best way to reach you? I know you said you're super accessible. And you
Yeah,
are.
so obviously, you can always reach out to me via IG. That's probably the easiest way to get
At
it. You
Dr.
can,
Mascaro.
yeah, at Dr. Mascaro. You can send us an email. Obviously, just let us know where you heard us from, and then
You see
I think
in town patients and out of town patients as
in
well.
town patients, out of town patients. I have a patient from Saudi Arabia that I'm doing surgery on tomorrow.
Nice,
So
sweet. All over the world, they
all
can
over the
come find
world,
you.
they can come from everywhere. We don't turn
And as
anybody
you guys
away.
can see, he is super personable. His bedside manner is impeccable, and he's just a great. He's just very cool. And if I were to do some type of procedure or any type of facial plastic surgery, I would definitely consider you. I highly recommend you. Anyone looking to do these types of procedures, these are the types of professionals you want to look for. He is the best in his craft. And if you are tired of lip filler and want a little lip lift, and this is the
do a lot
time
of
to do
those.
it, this
I
is
do a lot of
where you would
those.
go. But I do appreciate you coming. And if you guys found this episode helpful, make sure to follow us at the Plastic Girl Club Video Podcast on Spotify. We are airing live on Wednesday, and so we're super excited. Thank you guys.
No problem. My pleasure.